We get asked all the time by parents, do they really need to insure young children on their policy? And it's really relevant now as people are really looking at the whole affordability of their policy. My answer to that is yes. So bear in mind, if you put a newborn onto your policy, first of all, they're free pretty much for the next year. But secondly, they're insured immediately. There are no waiting periods whatsoever. So yes, if your child goes into hospital, they will be treated free in all the public hospitals. But unfortunately, nearly, I think 8% of all people on waiting lists are actually children. So the only way to skip those waiting lists is to have private health insurance, whether we like it or not. But the other thing that people miss is that if you wait to insure your children until they're older, and if you put them on the policy when they have an existing medical condition, and that might be asthma, it might be any condition whatsoever, that condition will be excluded for 5 years. So you could be paying for the child, but they won't have any cover. What I would advise anybody with young children is split your cover. You don't have to have the children insured on the same plan as the parents. And there are deals right now. Sometimes, for example, Leia Healthcare will give free cover for the second and subsequent child. The new provider, Level Health, they give free cover for all children under the age of 3. So we would always advise people, check out the lower cost options for your child dependents. But if you can afford it, try and keep them on cover so that if something does happen, and it's not about accommodation for children, it's about access. It means you can decide which hospital, which consultant, and hopefully skip those queues. So in summary, if it's affordable, we would advise you to insure your young children.